Hello, I'm Dr. Raymond Foley from the University of Connecticut Health Center, and we're here today to discuss Lung Talk. This is an educational series for patients, families, and caregivers. A patient educational booklet can be downloaded for free at www.lungtalk.org. Use it during the video to follow along and take notes. Throughout this presentation, you may hear different words with the same meaning: mucus or phlegm, medicines or medications, chronic lung disease, or COPD. 6 steps to stay well and out of the hospital. To stay well and out of the hospital, these are the following 6 very important steps. Number 1 is to stop smoking. That's first and paramount. Number 2, know your symptoms and have an action plan. Number 3, take your medicines. Number 4, go to all of your doctor appointments. Number 5, stay active and exercise. And 6, follow tips for healthy living. So we will be covering each of these separate points. Number 1, stop smoking. Stopping smoking is extremely important. Smoking is the most common reason for COPD. Smoking cigarettes harms the body, especially your lungs, and it will make your COPD worse. Talk to your healthcare team about ways that they can help you with quitting smoking.
I felt smoking was my best friend and my worst enemy. And how can you be both? But when you want a cigarette, it's your buddy. And then when you can't breathe, that was the devil climbing down your throat.
Stop smoking. If you stop smoking, it will help improve your breathing, you may be more active, and you will live longer.
I was a smoker for 45 years. And even knowing how bad it was for me, I was very dependent upon it. It wasn't easy. It was the hardest thing I've ever done in my life. And for me, who truly felt that I must be so addicted to cigarettes that I could not quit, I did.
Step number 2, know your symptoms and have an action plan. Every day, people with COPD may have a hard time breathing and/or feeling like they just can't catch their breath. You may hear a wheezing or a whistling noise when you breathe. Perhaps you may cough. The cough may be with mucus or without mucus. You may feel a symptom of tightness in your chest or chest discomfort and feeling tired. It is very important to know your symptoms, your everyday symptoms, and how you feel when you are well, changes in your everyday COPD symptoms, and when your symptoms regarding your chronic lung disease get worse. It's important not to try and beat your worsening symptoms. Call your doctor or your healthcare team right away so that they can help you.
If it lingers for a couple of days, and with COPD, it can go from a sore throat to maybe nasally, or like a nasal thing, and then I might have my sinuses might hurt sometimes, and then it's definitely it'll go into the chest. So I know at that point I need to call the doctor.
When your everyday symptoms get worse, it is called a flare-up or a COPD exacerbation. Flare-ups usually happen very quickly, and they're usually caused by triggers.
When you know your body very well, especially having had this disease for a little bit, you kind of know when things have maybe gotten a little worse than it should be.
Specific triggers for a COPD exacerbation include the following elements: respiratory infections, stress or anxiety, smoking, air pollution, changes in the temperature such as cold, dry, or hot humid air, not taking your medications as prescribed, or perhaps strong perfumes, odors, or air fresheners. Common flare-up symptoms include it's harder to breathe. So in other words, you know what your symptoms normally feel like, or your breathing normally feels like. With a COPD exacerbation, you'll feel that your breathing is harder or more difficult. You may notice more anxiety. Perhaps you may not be able to eat because you just can't catch your breath. You may hear a wheezing or a whistling noise that is new or perhaps worse than the usual wheezing that you'd had. You may feel like you have just no energy or more tired than usual, and it's harder to complete your normal day-to-day activities or household chores. Common flare-up symptoms also include needing to use more pillows or to sleep in a sitting up position, more coughing than usual, more mucus than usual, perhaps a change in the mucus color, perhaps a change in the mucus odor. There's a new or worsening chest discomfort or tightness, perhaps a fever or confusion or not thinking clearly. So these are all the common flare-up symptoms in regards to a COPD exacerbation.
Yeah, it feels like my body kind of like slows down a little bit, and the breathing gets a little tiny bit labored, and I'm feeling a little more tired, and maybe just I find I might sleep a little bit more during those times, and slows me down. Yes, it does.
This slide demonstrates the COPD zones. As you see at the very top, there is a table where you will list all of your medications, specifically the lung or pulmonary medications. There is your everyday inhaler, the rescue inhaler, and perhaps a nebulizer. You'll see there's a box or a region for your specific medication name, how much to take, and when to take it. Also is your primary doctor's name and phone number, your lung doctor's name and phone number, and then the COPD zones. There's the green zone, yellow zone, and red zone. In the next slides, we'll be describing each of these zones individually.
Well, I keep that chart in my bedroom, and it's in that little top drawer with the rest of my medications.
The COPD zones. You should ask yourself, what kind of a day am I having? The green zone specifically is a good breathing day. The yellow zone is a bad breathing day. And the red zone would be an emergency breathing day or very bad breathing day.
And it reminds me that, when I'm having my good days, which are the green, maybe the beginning of maybe a not so good day with the yellow. Or I definitely don't want to go to the red, I don't want it to even get to that point.
The green zone is a good breathing day. Specifically, that would include that your breathing is easy that particular day. You're able to do your usual chores or your usual activities, and you're able to sleep well at night. Your mucus, if you have mucus, is clear and white. It's easy to cough up, and you're able to think clearly. So what you should do is take your everyday medications just as ordered, and to continue routine or regular exercise. The yellow zone is a bad breathing day. Specifically, that would include that it's harder for you to breathe that day, you have less energy, you're coughing more, you're wheezing more, the mucus is thicker, perhaps it's changed color, perhaps it's yellow or green. You have a fever or cold symptoms, trouble sleeping, sleeping on extra pillows, or you're sleeping sitting up. It's very important at that point, if you're having a bad breathing day or if you're in the yellow zone, to call your doctor or nurse. Continue your everyday medications as previously prescribed. Use your rescue medications and perhaps start steroids or antibiotics as directed by your healthcare team. The red zone is an emergency breathing day. Specifically, it would include it's very hard for you to breathe, you feel scared, you just don't feel right, you have fever, shaking, chills, you're coughing a lot. You're coughing up a lot of yellow or green phlegm. You're not able to sleep at all. You just can't breathe. And importantly, your rescue medicines are just not working. At that point, what you should do is call 911, get help, and go to the emergency department. So patient example number 1, what we'd like to do is go over specific cases or examples to help illustrate the COPD zones. So Bonnie is a 56-year-old female, and she works with children for a living. She takes Advair and Spiriva along with an albuterol inhaler when she feels that she needs it. She has noticed a new cough over the past 2 days. Today, she has needed to use the albuterol inhaler as a rescue medicine 3 times. So what zone is she in, and what can she do? So for example number 1, Bonnie would be in the yellow zone. Specifically, she should call her doctor or nurse and report these symptoms. And perhaps her healthcare team may advise her to take an antibiotic or steroids, such as prednisone, to help with her breathing condition. Patient example number 2. Myrna is a 75-year-old female. Her medicines include Spiriva and Advair, along with an albuterol by nebulizer when she feels she needs to. Normally, she has some trouble breathing when she takes a shower, and after her shower is done and she's finished, her breathing goes back to normal. What zone is Myrna in, and how can she make her breathing better when she takes a shower? Well, at this point, Myrna is in the green zone. Myrna normally experiences some difficulty breathing when she takes a shower. However, it clearly and quickly goes back to normal for her when she rests. And what she should do is to consider using a shower chair to decrease her work and to save her energy when she's taking a shower. And the other element to consider would be to use albuterol prior to taking a shower to help her breathing. Example number 3. Walter is an 80-year-old male, and he lives at home with his wife. Walter gets help from a nurse's aide with some of his daily activities. When the aide, Sheila, arrives at Walter's home that day, his wife tells Sheila that Walter's had a bad night and he had to sleep sitting up in bed. Sheila helps Walter to the bathroom that morning, and he has a hard time breathing. Walter took all of his medications as he was instructed and even took a nebulizer before Sheila came to see them. So at that point, what zone is Walter in, and what should he and his wife do? Well, in example number 3, Walter is in the red zone. This is an emergency breathing day, so he should get help right away. Using the COPD zones. Check your symptoms by using the COPD zones every day. Tell your healthcare team which zone that you're in each and every time that you call them or when you go to the doctor's office. Follow the directions in the action plan in your zone. This will help you stay well and out of the hospital.
When I need to call my doctor, she's always readily available, and even the nurses at this point, they know me, and they usually know when I call this is for a very good reason. But I know too that one of the biggest steps for me is to, do my part so that I don't have to call. I do everything to the best of my ability to manage this disease so that I don't have to have these flare-ups, and just try to stay as healthy as I can. That's the most important thing to me.
Step number 3, take your medications. People who take their medicines as told tend to feel better and spend less time in the hospital. Types of COPD medicines. COPD medicines may include oxygen, pills or tablets, a nebulizer, or inhalers. What is an inhaler? An inhaler is a device that inhales medications when you breathe in, as you see in the cartoon. There are 2 main types of inhalers. There's your everyday inhaler and rescue inhalers. The everyday inhaler is medication that you should use each and every day, and you should use it even when you're feeling and breathing well. The rescue inhaler specifically you should use when you have a hard time breathing, when you have the sudden onset of symptoms, and when you're in that yellow or red COPD zone, like we discussed earlier. Using inhalers correctly. Inhalers are the best medicine to avoid flare-ups and having to go to the hospital. Studies have shown that many people use their inhalers wrong. There are different types of inhalers, and there are different ways to use them. Your inhaler won't work unless you use it correctly. So it's very, very important that you talk with your doctor or healthcare team to make sure that you understand how to use your inhaler the correct way.
With the inhalers, they can be kind of mysterious, I think, because some you're supposed to breathe deeply, others you're supposed to use with a spacer, and others you don't use. So it gets confusing, and I think sometimes overwhelming to people. There's a lot to learn.
What is a nebulizer? A nebulizer is a machine that can be used to get medicine into your lungs. Different medicines are used with the nebulizers. Oxygen. Oxygen is a gas that is used as a medicine. Please remember that we consider oxygen a medication. You may need to use oxygen when you have COPD. Oxygen goes where you go. There are lightweight tanks that are used by patients when you leave the home.
Now, I have oxygen, but you know what? This is my friend. Oxygen allows me to do just about anything I want to do. Maybe a little bit differently, but you want to do it? Let's go. We'll go do it. Oxygen doesn't stop me. It helps me.
Oxygen do's. Do know how to use your oxygen machine. Do keep your oxygen tanker machine away from heat and direct sunlight because that may affect how the machine works. Do turn your oxygen tanker machine off when you're not using it, and wear your oxygen tubing correctly. Oxygen don'ts. Don't smoke when wearing oxygen or near your oxygen machine. Oxygen is flammable. Don't use your petroleum-based products in your nose when you use oxygen tubing, because again, petroleum-based products with oxygen is flammable. Don't use your oxygen near open flames like a gas stove, a fireplace, or candles. Pills. You may take pills or medicines for your COPD. These pills can be antibiotics that may help fight an infection, steroids to help reduce swelling or inflammation in your airways, or medicines for anxiety or depression. Tips to follow. Keep an up-to-date list of all your medications. Share this list with your healthcare team and bring the list to all of your appointments and any visits to the emergency room. Know how to refill your prescriptions. Call your doctor's office a few days before you run out of your medicines. It is important to ask yourself, how will you get to the pharmacy? Will your pharmacy deliver? Talk to your doctor or healthcare team if you can't afford the cost of your medications, because there may be solutions for this. So in summary, take your medicines as your doctor or healthcare team has explained to you. Take all of your medications, even when you're feeling well. And don't stop taking your medicines without talking to your healthcare team first. Step 4. It is important to go to all of your doctor's appointments. Specifically, even if you're feeling well, especially if you don't feel good, and tell your healthcare team what zone you're in at each of your appointments. Remember the prior COPD zones, the red zone, yellow zone, or green zone, like we previously discussed.
Well, you know what? I never miss my appointments. Oh, not my pulmonary appointment, because that's the one that keeps me breathing. But even if I felt good, and I know in the back of your mind you might say, "Oh, I feel good. I'm not going to go to that doctor on that doctor's visit." But I would strongly suggest that to go, whether you're feeling good or not, because you're going to learn something.
Tips to follow. Bring a family member or friend into the appointment with you. I have personally found that it is very important and helpful for patients to have someone else with them during their appointment. Bring all of your medicines or medication list to your appointments. Ask questions to your doctor, nurse, or healthcare team. If you're worried about forgetting about a specific question or concern, write them down and bring it with you to the appointment. If you speak a different language, ask for an interpreter, because there's always help available for that. What you need to know, that patients who go to their doctor's appointments in general feel better, and studies have shown that they spend less time in the hospital. Step 5, exercise and activity. Exercise and activity can include things such as cooking, bathing, dancing, swimming, walking, yard work.
I do try to get as much exercise as I can, and I do walk. I realize, what I really do is I walk in place. Sometimes the weather doesn't permit to go outside, but I'll walk in place for about 20, 30 minutes if I can get up to that speed.
Exercise and activity are extremely important for your chronic lung disease, or COPD. Specific activity level must be determined by your healthcare team. Exercise is generally safe and helpful for you, and a pulmonary rehabilitation program is a safe and effective way for you to get exercise. What is pulmonary rehab? Pulmonary rehab is a supervised exercise and educational program which includes information on your lung disease and how to manage it, tips on how to save your energy and to breathe easier, instruction on how to take your medicines properly, also tips and information on how to use your oxygen and how to use it safely, information on healthy eating, along with other aspects such as emotional support and self-help. Pacing yourself. It is important to use your energy when you need it most. Pacing yourself and your breathing will help you keep active. Ways to save your energy would include sitting down during certain activities such as brushing your teeth or showering, keeping your most used items within an arm's reach and waist level, planning your day, and taking rest breaks at different parts during the day.
If I start, I just stop and I just catch my breath and then I continue going, or like even the dishes. Sometimes if there's a lot of dishes, I'll, work it gets me to where I'm breathing, fast. So I'll just let the dishes air dry. I'll go sit down, watch Days of Our Lives. And then after that's done, I'll come back and I'll finish drying the dishes and put them away. And then I'm fine.
Pacing yourself and breathing. People with COPD may need to breathe using different techniques to help them feel well and to stay active. These techniques can make breathing easier during exercise and activity, stressful or anxious times, and during everyday activities. As you see in the cartoon, stress and anxiety can lead to more difficulty breathing and your muscles getting tired. When that occurs, you may not be able to perform your activities of daily living, such as chores or eating. In general, you'll start to notice that it's harder to breathe. You may notice a feeling of panic, more anxiety, and that can then in turn lead to more anxiety and difficulty breathing. So it truly is a vicious circle.
The pursed lip breathing, where you're breathing through your nose and out through your mouth, you catch yourself before you start panicking and going, it helps a lot.
The following will be a demonstration of different breathing techniques, which include pursed lip breathing and diaphragmatic breathing.
Pursed lip breathing is very important for people with lung disease. It helps get the air out of your lungs. You want to breathe in and blow out 4 times as long as you breathe in. The best way to do it is to be in a chair with a back or your back supported in bed or with pillows at night. The more you repeat it, the more you practice, the better you'll be at it. You want to breathe in through your nose and blow out through pursed lips, 3 to 4 times longer than you breathe in. You're going to use your diaphragm, which is the most important muscle for breathing. Put your hands on your belly. Breathe in through your nose, blow out through pursed lips. As you breathe in, your belly should rise. And as you exhale, your belly should fall. You don't want to use your upper body and your shoulders, but you want to work on the belly breathing, the diaphragmatic breathing. Pursed lip breathing should be used all the time, including during exercise. However, if you get short of breath, you can use rescue breathing, which is different positions that can help support your body so that you can breathe easier and catch your breath. Rescue breathing can be used for times when you're short of breath or when you're doing an activity that makes you short of breath. The purpose of rescue breathing is to elongate your chest, have your belly drop out of the way with gravity so you can take a deeper breath. Then you need to use your pursed lip breathing. Breathe in through your nose, blow out through pursed lips. Make sure that your blowout is longer than your breathe in until you regain control of your breathing. Breathe in through your nose, blow out through pursed lips. The chair is supporting my chest so I can breathe easier. You can also use the counter in your kitchen, or you can put your arms up against the wall when you're out in public, just to catch your breathing.
In summary, staying active helps you breathe better. Breathing techniques will make your breathing easier. Staying active and exercising will help you stay well and out of the hospital. And saving your energy will help you to continue to enjoy what's important to you.
And being in the hospital wasn't too much fun, and it, affected a lot of things. And since I've been doing this, I haven't been in the hospital in 3 years. So I live in fear of ending up in the hospital, so that's why it's become my job. My job is to keep myself healthy and out of the hospital.
Step number 6, follow tips for healthy living. Healthy living is about doing the things that will keep you feeling well and out of the hospital. Stopping smoking, talking about your feelings, avoiding getting sick, and eating right. Stopping smoking. Smoking is the most common cause of COPD. Stopping smoking will help improve your COPD symptoms. Talk to your healthcare team about ways to stop smoking. Even if you've tried to stop smoking before and you subsequently failed, studies have shown that if you continue to try to quit smoking, you may be successful in the future. So don't give up and keep trying to stop. Talking about your feelings. If you have COPD, it is common to feel anxious, depressed, or nervous. Tell your healthcare team if you feel worried, sad, or nervous. There are medicines that can help you feel better if you have these symptoms. So it's important to talk with your healthcare team about these symptoms, because it's important to treat the person as a whole, and your feelings and mood are important to consider. Anxiety and breathing. Anxiety is defined as a feeling of worry or nervousness. As we discussed before, anxiety may make breathing harder. Using breathing techniques can help you with breathing easier, and when you're breathing easier, you may notice less anxiety. As we discussed before about the vicious circle, that stress and anxiety may lead to more difficulty breathing. When you have difficulty breathing, you may not be able to do the activities of daily living. When you're not able to eat or do certain chores, you may notice that things are getting worse. You may get more panicked, more stressed, more anxious. And again, those symptoms can lead to more difficulty breathing or shortness of breath.
Started to realize there were times that I couldn't function very effectively because I would get anxious. And I don't know, but I am kind of presuming that I'm not the only one who is in that position. The anxiety for me came because I couldn't breathe, which I never realized or thought of myself as a person who had real anxiety, but all of a sudden I did. But when you can't breathe, you have anxiety because you think, oh my God, am I ever going to breathe again? And you realize that you better do something about it. And there were several times that I ended up in the hospital for that reason. And I was not necessarily having an exacerbation. It was not necessarily the COPD that brought me into the hospital, but it was my anxiety. And remember your breathing and, smell the roses and, all the things that they teach you here. And so I started doing that. And every now and then I'd have to take a Xanax because it just really wasn't enough on my own. The air's coming at me, and I start my deep breathing and my exhaling, and that gets me through it.
Eating right. To make breathing easier, experts recommend that eating smaller meals more often during the day is helpful. Avoiding dairy products is also helpful because dairy products can increase the amount of mucus that's produced by your lungs. It's also important to avoid foods that may produce gas, and it's also very, very important to stay at a healthy weight. As a physician, we generally recommend avoiding the extremes. It's not healthy to be underweight or too skinny, nor is it helpful to be overweight or too heavy.
I try to eat well. I think a healthy diet really helps a lot. I notice when I eat better, I feel better.
Eat several times a day rather than 3 big hefty meals. And I found that, and also as I've gotten a little older, that I can't eat quite as much. But it's also true with the COPD, your stomach sort of, and your lungs and everything sort of expands, and you just can't take in as much food because you feel very full and uncomfortable.
Try not to get sick. There are strategies to avoid getting sick, which are very, very important. The following include washing your hands often, keeping your hands away from your face. If you have germs on your hands and you touch your eyes or your nose, that could spread those germs to those parts of the body, and that could then lead to a cold or respiratory tract infection. If you are sick, sneeze or cough into your elbow to avoid spreading those germs elsewhere. It's also very important to get the flu shot every year and the pneumonia shot or pneumonia vaccine as well. If others are sick, they should stay away from you. And if you are sick, it is important to stay home and rest and recuperate.
Well, I always wash my hands. What do they say? Germophobic? I think I am. I think you get to be when you have COPD. I make sure I get all of my shots, my flu shots every year. I even get a pneumonia shot.
Try to keep sick people out of the house. And I tutor a child a couple days a week, and he's been sick. And so if somebody's really sick, it's not you don't want to see people, but sometimes I don't want somebody in my house who's got a bad cold or germs to spread. We use a lot of the hand wash, sanitizer things.
In summary, these healthy living tips will help you keep feeling well, and if you follow the healthy living tips, they'll also keep you out of the hospital as well. In conclusion, for this module, we have discussed several important themes that will help you stay well and out of the hospital. First and foremost is stopping smoking. That is number 1. Number 2, know your symptoms and have an action plan. This refers to the COPD zones that we just discussed. Number 3, take all of your medications and take them properly. Remember, if you're not sure or if you have a question, don't hesitate to ask. Number 4, go to all of your doctor appointments, whether you feel well or not. Number 5, stay active and exercise. moving and exercising is very important for your health. And 6, follow the tips for healthy living that we just discussed.
I've never been in the hospital for my COPD, so I want to keep it that way, and I think maybe this is the way to do it.
For more information on the Lung Talk videos, please visit our website, www.lungtalk.org, or email us at lungtalk@qualidime.org. I'm Dr. Raymond Foley from the University of Connecticut Health Center. I hope you enjoyed this module, and I wish you all the best. Thank you very much.